Dr. Napolitano, let's talk macular degeneration. Kind of what is it? And please explain it a little bit in relation to other illnesses such as cataract, such as glaucoma, even maybe normal nearsightedness or farsightedness. Explain to us a little bit of, how it feels versus the other one, because some of us consistently confuse those things in terms of symptoms.
Well, macular degeneration, it's also referred as age-related macular degeneration because unfortunately shows up later on in life. And by that I mean late 60s, 70s, 80s. What causes macular degeneration is pretty much the pigment that we have inside the eye starts to break apart. And that sometimes causes either leakage of fluid, whether it's blood or other type of fluid inside the eye, inside the retina, or accumulation of pigment back in the back of the eye in the specific region of the retina that's called the macula. Neither form is good to have. The what's called the dry macular degeneration, we don't have any blood there. There's no fluid there, but there is no treatment for that. The other kind, it's called the wet macular degeneration. It's called wet because we actually have some fluid there, usually blood. There are nowadays some very advanced treatment that we do for macular degeneration, which sort of stop the bleeding and stop whatever bleeding is there from becoming a scar. That's what causes most of the vision loss. Not everybody gets macular degeneration. Macular degeneration, one of the biggest factor involved with macular degeneration is the UVs of the sun. That's why it's very important to wear sunglasses all the time, especially if your eyes are light in color. If you have blue eyes, green eyes, you want to wear sunglasses all the time. Even if you have brown eyes, but just that the people that have light color eyes are more at risk for macular degeneration versus people who have brown eyes. Cataracts, on the other hand, everybody gets cataract. If you live long enough, you will have cataracts. You will have some sort of cataracts here. And cataract, although causes vision loss, it's very easy to treat. It's very easy to fix. It's a quick surgery. We remove the cataract, which is basically the lens that we have inside the eye that with time becomes more yellow. So it's like looking through a dirty window, a dirty eyeglass. A lot of my patients come in and they say, I keep cleaning my glasses, but my vision just doesn't get better. That's because the problem is not with the eyeglass, but it's with the lens found inside the eye. And treatment for cataracts is just, as I said, quick surgery. They remove the lens that we have there. They put an artificial lens, nice and clear, and vision usually becomes normal by the next day. Versus macular degeneration.
Yeah, let's get back to
macular degeneration.
The treatment and...
although we have the treatment for the macular degeneration, but we can still have severe vision loss from macular degeneration.
Got it. So, again... at one point you mentioned, on glaucoma, you just gotta you get it or you don't get it, but then you need to, try to slow it down, is kind of what you've done. Is macular degeneration the same thing? What are the symptoms if you have them? What is I get it at age, you said most people get it elder, so I'm going to be about qualifying for it. And on top of it, I skied my whole life with never a sunglass on it. I think only at the age of 19 for about a half a year I wore sunglasses to look cool, but I didn't like them, so I never ever, rather than that, wore sunglasses. So I don't know what eyes I have, but brown, I think. So what could I expect? How does it show to me that, oops, something is wrong? Or doesn't it?
Well, the macula is the part of the retina that pretty much allows us to fixate. So right now, if you're looking at me, that's the part of the eye that you're using. You're using the macula. So usually, people that have macular degeneration, they will come in and say, I see something right in front of my eye that it doesn't go away. It's always there. Usually they describe it as a black spot. Okay, that's what they describe it, right in the center of their vision. And that's macular degeneration. It does not, glaucoma, we talked about glaucoma. Glaucoma affects mostly your peripheral vision. So the side vision, okay? But your central vision is still intact. Macular degeneration, on the other hand, does not affect your side vision, but it affects your central vision.
I see.
Okay.
So there's a little black spot there. And that black spot, as it progresses, gets bigger and bigger, and soon you see...
Gets bigger and bigger.
Got it.
Correct.
So, to the point question, can it be prevented? Can it be slowed down? Yes or no?
Well, prevention, yes and no. As I said, wearing sunglasses is the best prevention we have against macular degeneration right now. Just like skin cancer, you want to use the right UV protection. Same thing for the eyes. So I tell all my patients, no matter what their age is, I really want to emphasize wear sunglasses all the time, especially when we have snow on the ground, because the snow reflects even more UVs than anything else.
Thanks
but as far but that's the best prevention we have. And again, as I said, regular eye exams. If you are 65 and older, definitely yearly eye exams are strongly recommended, even if you don't notice any change, because if there is any change.
So we detect we have it. 60, and we detect we have it. All the prevention, whatever we did or didn't do, we have it. What then? Can it now be taken away, like appendix? Today you have it, tomorrow you don't? Or can it be like glaucoma, where it's only be tempered in progression?
Exactly. It's like glaucoma. Unfortunately, there is no cure. There is not, okay, you have macular degeneration, take these pills for 10 days and you're going to be fine. Unfortunately, that's not the case. As I said, we do have more advanced treatment right now for macular degeneration, but it only slows it down. It only slows it down. Whatever vision is lost, we cannot bring it back. We just try to save whatever is left.
Got it.
So now, early detection is the key.
All right. So can you slow it down? Let's just say at age 45, 50, there's that tiny little bit. It's just, not necessarily bothersome yet. Maybe the person even himself. By the way, question: does an eye exam detect it faster than I will detect it myself?
Absolutely.
No, all right.
Absolutely.
So let's just say you detect it, and I haven't really detected it yet, even though it's there. Can you now slow it down for another 30, 40 years, and now for me to be going through life and say I was fine?
Unfortunately, I would love to say yes, but no. First of all, let me just say something else. The macular degeneration we're talking about right now, it's never going to show up in your 40s or your 50s. As I said, unfortunately, it shows up later on in life. So it's not like you're 40, you come in for your eye exam today, and I'll be able to tell you you're going to develop macular degeneration later on. Unfortunately, I can't say that. Nobody can say that. But let's say you're 60, 65, you come in my office, you haven't noticed any vision problem, your vision is great, but when I check in the back of the eye, I start seeing some changes there. Now, maybe instead of seeing you every year, I'm going to recommend you coming in every 3 months or every 6 months. So if it does change, now we can intervene right away versus waiting for you to notice that, hey, I have that black spot in front of my eye.
Right. And at that point, so since it's an age thing, 60, so I'm 65, you detected something, it doesn't really bother me yet, can you get me through the rest of my life, more or less?
Hopefully, yes. There are some aggressive cases of macular degeneration. We're not all the same. It doesn't progress at the same speed for everybody, but in most cases, we definitely can slow it down to the point where you can preserve some vision.
Okay. Now you mentioned this black spot in the middle, kind of like it just doesn't go away.
Right.
I heard about, and in fact, I sometimes, and I don't know why, when, and why yes and no, I have a brownish gray spot, but it's not in the middle, and I feel like, having something stacked, but apparently I don't. It's there. It looks like, especially if I look, I know when on my scale and there's a white wall in front, I seem to be seeing it there. Is that the same spot, or is that a different spot?
What you're describing sounds more like what we call floaters. Floaters, on the other hand, in most cases are very benign. Many people have them. Some people describe it as just a black spot moving around. Other people describe it as a hair or a wavy line. Those, on the other hand, that's a normal aging process. That's the gel that we have inside the eye that it's called the vitreous, that as time passes becomes more liquid, and therefore it tends to separate, it tends to break apart. And because the eye is a closed space, once this separation occurs, it really has nowhere to go. So it's just there and it starts moving around. Eventually gravity sets it down, so you don't notice it anymore for maybe a few days, a few weeks, and then it comes back up. That's normal. If it moves, if it comes and goes, that's normal. Okay?
That's nothing to worry about.
That black... Well, in some cases, they do cause some problems. If it's something new, if you start noticing an increased number of these floaters, if you see any flashes of light associated with these floaters, then that could mean something else. That could mean like a retinal problem, whether it's a retinal detachment or a retinal tear, and that needs to be looked at. But if you have this one floater there for years, comes and goes, it never changes, the number is still the same, you only see one of them, then in most cases it's benign, there's really not much we can do for that. Macular degeneration, yeah, it's always in the same spot, it's in the center, it doesn't move.
I like your explanation. I think I understand it, and I'm sure that people watching this video will understand it and appreciate it much more. Thank you very much, Dr. Napolitano.
You're welcome.